We have a visiting team from Long Island University, head by Dr. Dale Coffin. She's an occupational therapist. They brought along occupational therapists, 3 physical therapists, and a developmental pediatrician who specializes in autism, behavioral analysis, anything that has to do with behavioral changes in children. And that's the entire team with 18 students. They're holding a clinic. They're seeing almost all of our patients, and we saved our specialist doctor to see our autism spectrum children and children who really don't have a diagnosis per se but have behavioral problems. So they're doing OT and PT here at the center.
Occupational therapy would entail what?
It entails just basically life skills. It's a gear towards independence. Teaches the kids how to do things for themselves, gross motor and fine motor wise, as in like buttoning a shirt, tying a lace, and it's just teaching them for independence. It's something that we see across the board. It's seen with children with autism spectrum disorders, our cerebral palsy children, our Down syndrome children. It's seen in all of them because they have difficulty with fine motor, as in like buttoning a shirt and doing things with the fingers, their digits.
Physical therapy?
Physical therapy.
What does that entail?
It's just doing activities, stretching to help them in gaining strength in muscles and things like autistic children, because then they tend to have difficulty in walking. They walk on their tippy toe.
Talk to me in terms of developmental pediatrician. What is that? What does that entail?
Just like it says, it works in dealing with from birth the different stages, because children are supposed to be meeting certain milestones at a certain age, and if they're not meeting them, you have to find out if it's why they're not meeting them. And with certain conditions, they develop behavioral issues as well, anger, self-mutilation, and things like that come into play with different conditions that we have to nip in the bud from the beginning with a developmental pediatrician, which we don't have in Belize, so we just get them in visiting teams. So whenever they come, we try to have them see as many children as possible.